gynecologist and obstetrician from Agra. Today, the topic of our discussion is, can we breastfeed by taking any contraceptive birth pills? And we are going to go deeper into this topic because a lot of moms ask about the natural ways of contraception, or what are the medical ways by which they can prevent being pregnant because they already have a small baby. So to share all the information, we have invited Dr. Shubhanjali Sen. Welcome, Dr. Shubhanjali.
Thank you. Thank you, Dr. Pankhuri.
Yes. So doctor, how important do you think is breastfeeding, especially now in the COVID times? And what message would you like to convey to the moms who are, recently they have delivered or they are pregnant, they're expecting their baby? What do you feel?
Thank you for a very wonderful question to start with our talk, Dr. Pankhuri. And yes, it is actually a matter of concern right now and a big controversial discussion that normally we keep promoting our mothers to breastfeed, but as it is pandemic and COVID, which is being transmitted from any human body to the another human body through the air droplets. So there is lots and lots of controversies and misconceptions regarding whether the mother should breastfeed the baby or not.
Yes.
So here the answer I would say is, see, breastfeed is such a thing which is extremely important for the baby. And all the viewers who are viewing and listening to us, and as we are promoting a breastfeed awareness week, so you should understand how important, how nutritionally beneficial it is, and how such a beautiful gift you are giving to your baby. Because whatever that breast milk is containing, you cannot give all those nutritional elements to the baby from the external source.
Absolutely.
So whether it is a pandemic, whether it is respiratory droplets, a mother can actually wear a mask. It can be a double layer mask. She can cover the baby properly. She can actually prevent handing over of the baby to the other people. Prevent or ask the elders to not, come very commonly, frequently to the room, and she can very well breastfeed the baby. And in fact, I would promote, and I am promoting in all my cases, that with this pandemic era also, you are supposed to breastfeed your baby.
Yes. So I think, doctor, a lot of people don't know about this. There was not much talk about this because it was all of a sudden that we had to face the pandemic. So, I recently got so many clients who, deliberately just after giving birth, to some relative of theirs, and the baby was shifted and was kept away from the family because all the family members were COVID positive. So, I really feel that, a lot of information could have been passed on.
Yes.
And, because then, the mother and the baby separation does more harm than ever. And I believe that especially the early days after birth are to be spent with a lot of skin to skin care, a lot of breastfeeding, a lot of touching, and a lot of talking with the baby.
Yes.
So,
Yes.
a lot of mothers were deprived of that in that confusion and, in all of that chaos. So, we together wish that any new moms or expecting moms who are watching us should continue breastfeeding during the pandemic. And that's what we should do. So let's proceed with the questions, Dr. Shubhanjali. A lot of moms, want to know that how, they can prevent being pregnant if they are breastfeeding a baby. So, any highlights on that you would like to share?
Yeah, it's a major concern. And this is also one area where a lot of people are not properly aware, and they keep coming asking, and the couple is quite conscious now what next you have to do. And definitely, yes, spacing method is very much required for the another conception. As the mother, we don't want that the mother should be nutritionally be deficient. So there are certain methods. See, breastfeeding itself, we say it's an ovulation inhibitor. Ovulation inhibitor means that how the pregnancy is happening is every woman is going to ovulate. The ovary is going to produce one egg. And when that egg fertilizes with the male sperm, then the baby is formed. So once the mother is breastfeeding, the fundamental what God, the nature has given to every woman is naturally it prevents that ovulation method to happen. And in 90% of the cases, when
Yeah.
any mother is actually breastfeeding for the exclusively for the 6 months with taking care, so yes, she helps in the prevention of a spontaneous pregnancy. But on the contrary, I cannot say that yes, it is 100%, 100% efficacy that if you are breastfeeding, so yes, 100% you'll be absolutely be tensionless that you will not have a pregnancy. So once any mom is breastfeeding, you can actually use a barrier method, that is condoms, which is very easily available. And with that condoms, because during breastfeeding, what patients complain, there is a lot of dryness in the vagina because there is
Yeah.
loss of estrogen.
Postpartum.
Yes, there is
Yeah.
loss of estrogen. So you can also use any spermicidal gel. So it helps in two ways. It is giving you a barrier contraception. Secondly, it is also helping if in any situation the condom is ruptured or it has got a leak. So that spermicidal jelly will not let the sperms go inside the uterus.
Okay.
So that is one of the most common and economical way that any couple can go ahead when a woman is breastfeeding.
Absolutely.
Yeah.
Yeah. So, as a gynac, what are the guidelines for resuming, your sexual life, and what timeline do we tell the clients and the couple per se that from when they can resume their sexual life?
So to resume their sexual life, it all depends upon the couple's psychology actually. See, there are a lot of women. Normally, there is no such particular guidelines.
Mm-hmm.
Postpartum period is of 45 days.
Mm-hmm.
So in that puerperial time, what happens is there is a lot of body changes and lot of involuntary changes which are happening. So the women, I feel women will not feel comfortable. Like majority of the women will feel because a lot of secretions are happening. She's breastfeeding the baby. She's smelling a lot. She's little messed up with the things. If you just go psychologically, then it absolutely depends upon a woman. But if you really want to know that what time, if we recommend, like after a c-section, after 10 days or 20 days, if she's comfortable, she can resume her sexual life. If she's not having any other kind of a problem, stitches are absolutely okay, she's moving ahead, she's working, so then there is no such kind of a problem. In a normal delivery also, there is no such kind of a problem, like the stitches are being given. And if the
Mm-hmm.
stitches are absolutely healed, so she
Mm-hmm.
can again resume it within 15 days or 20 days. So there is no such kind of a guideline.
Line. All right.
Yeah, yeah.
Yes,
There are,
that was
see, a
very
lot
good.
of men will come and they will say that, she's not sleeping, she's very anxious about, and a lot of other troubles keep happening. So this is more of a psychological counseling than of a physiological condition of a patient.
Yeah. So, there's also a lot of misinformation regarding this. So it was really beneficial from you, telling all the listeners and everyone that, there's no guideline, and it
Yes.
depends upon your comfort level and
Yes.
what is your
Yes.
statistics, what all happened with you, how was
Yes.
your birth and everything. Great.
Yes.
Okay.
Yeah.
So,
Yeah.
Dr. Shubhanjali, what do you think is, the most effective birth control method during breastfeeding?
Okay, yeah. See, there are two ways. We can either go non-hormonally, okay, and
Mm-hmm.
or we can go hormonally.
Okay.
So what happens is that if we
Mm-hmm.
talk about a non-hormonal method, So here in this condition, we are not bothering the menstrual cycle of the patient. Here we have to actually understand one important factor, that when the mother is breastfeeding, at that moment of time, she can have completely cessation of the periods, or she can have her periods while she is breastfeeding, which can be irregular or regular. All the three things can happen, right? So we'll take one by one.
Yeah.
And you can just ask up any query. So see, if any woman is completely having a regular cycle, regular periods she's having, which some very small chunk of the patients will be having. If they are very much cautious that in spite of having their regular periods, and they are, they are more conscious, they don't want to have the pregnancy, second pregnancy, they can abstain their sexual cycles in the ovulatory phase, and they can resume their sexual activity with the help of a condom. That is, if you start your periods from day 1 of the month, from day like 1st of August. So from day 10 to day 18, it is the ovulation period. So in 10% of the patient, the ovulation will be happening. We cannot predict that. So that duration of time, you can abstain your sexual activity from the day 10 to day 18. And if in any situation it happens, you can just simply take condom, or you can take a vaginal condom, which is a diaphragm. You can use that. Even you can just simply take, if in case it happens not a unplanned intercourse happens, you can take one. There is a mini pill which is there, which is like within 72 hours you may take. You may take, because it is not harming the baby also.
Yeah.
So this is in those conditions where the periods are regularized. Now, if we take those patients where the periods are not regular, like they are having 21 days or sometimes 35 days, except with the things. So there the miscalculation can take place. Patients, definitely, for a mother, it is very difficult handling the baby, day and night activity, and along with that menstrual tension कि अभी मुझे हुआ और फिर 15 दिन बाद हो गया. That really creates a lot of stress to the women.
Yeah.
So here in these kind of patients, we try to give them certain kind of pills. So those pills are very helpful. Those are very, very, very less hormones, and it helps in the regularization of the periods, as well as it also inhibits the ovulation. Like it inhibits, but it is also along with the help of a barrier method, that is condom. If used, it will give an effective way. Yeah. Secondly, in these conditions, what happens if you miss the timings? Like for instance, you are every day taking by 7 p.m. in the night. And if you just miss the timing, you take it by 9 or 10 or 11, simply, because of the babies doing so much of badmashi. So what efficacy of the drug reduces? So it is actually only one hormone which we give to the patient, and we educate the patient. So here it is the attentiveness of the attendants, like the husband and the women, how much comfortable they are to take that pill every night. And it is a pack that you have to take continuously, so that there is no such kind of attention that yes, day 5 I have to take, or day 10 I have to take, or I have to stop the medicine on day 1. So it's not like that. But yes, the timings have to be perfect. So this kind of a thing can be given to those patients who are menstruating irregularly, and also those women who are not menstruating at all. Yes.
So this we will do as a preventive thing for them.
Yes. It is. Our idea is that when we are providing a certain kind of a hormone, that hormone is a progesterone. So when we provide progesterone hormone to the body, it creates the condition in such a manner that it will inhibit the mating of the ova and the sperm in all the conditions, like at the level of the level of the uterus, the level of the fallopian tubes, the level of the action inside the uterus and the fallopian tube, which is going on. So there is a whole lot of mechanism which is going on, but it has to be judiciously taken care of.
Yeah. absolutely. So they should be
Yeah.
guided well about
Yes. Yes.
medicines, because
Yes.
they are breastfeeding, and that should not
Yes.
affect it,
Yes.
in any way. Yes. So, Dr. Shubhanjali, would you like to share some, experience of using the non-hormonal methods of birth control, methods which are available? Would you like to highlight on that?
Uh, I think non-hormonal methods are only two methods. We are simply the condom is the only method, or a spermicidal jelly is the only method. So other than that, we are having copper tree also.
Hmm.
But copper tea here we can actually insert the copper tea. There is no problem. But there are a lot of myths regarding the copper tea to the women.
Okay.
And every now and then in the second patient there are lots of myth that अगर मैंने multi load या freedom 5 या copper tea लगवाया तो मेरे बचनानी में कैंसर हो जाएगा, वो ऊपर चली जाएगी. There are so many myths and notions.
Okay.
I would say it is a very effective method because we say that the reversibility after using a copper tea load, whether it is a Freedom 5, anything, any kind of a copper tea you are using. Now, it is actually very nicely prepared by the companies. It is not in the crude manner. The
Hmm.
kind of substances which we are using are very much helping the uterus to prevent the pregnancy to happen.
Okay.
And whenever we provide any intrauterine contraceptive device, the most important situation is the reversibility of the pregnancy, like the fertility.
Mm-hmm.
So it is the safest method which any women can opt for. And in some schools, there is a school of thoughts, it is being practiced that once the delivery has taken place, whether by a C section or by a normal delivery, they insert the copper T immediately after the delivery or within 72 hours of the procedure. So lots of practice has been taken place in the olden days. Still, in some institutions, it is being advised, and women take care of it. But
Okay.
the failure rates are also very high in such kind of insertions of copper T. So that is why the women become very hysteric कि हमने लगवाया था, वो निकल गया, वो ऊपर रह गया, और हमें इतना प्रॉब्लम हुआ. The
Mm-hmm.
best method is that once the puerperium, that is the 45 days from the day you have delivered, that
Mm-hmm.
period is being crossed. And if you have got a period, or if you have not got a period, you are very keen on taking a copper tea or a multi-load, you can just consult your doctor. She
Mm-hmm.
can help you with the periods to happen. And then she can
Mm-hmm.
give you one particular date, and we can very well insert the copper tea. And any time in the future, within 2 years, 3 years, 1 year, whatever is the time duration, the spacing you want, you can
Okay.
simply ask the doctor to remove the copper T.
Good. That's, I think, for people who don't want to go for the hormonal treatments, or
Yes, yes,
want to avoid the pills and everything,
yes,
so they can get the counseling done in a right way from the.
yes, yes, absolutely.
Yes. So thank you, Dr. Shubhanjali, for this. And a lot of moms want to know that, all the hormonal treatments which they are going to take for controlling the, contraception methods, whatever they are going to take, should they be affecting the milk supply in any way? So, as far as till now, being a lactation consultant, we know that you can safely breastfeed. And we I think we should talk about the hormones, the progesterone based hormonal pills and the estrogen based pills, because I think that the estrogen based pills can to a certain extent affect the milk supply. So any insights on that? Are the clients guided about
Yeah.
that, or is there anything like that?
Yes, yes. It's actually a very useful and very question which is thoughtful about. And here, see what happens is in the general concerns, what we usually see is sorry, if any patient is experiencing simple troubles, like this is a very simple trouble, to the
Mm-hmm.
patient. As per the patient, they will just go to the nearby medical store and they
Mm-hmm.
will ask for the oral contraceptive pills and
Mm-hmm.
they will simply start taking them.
Yeah.
And they will simply go to any nearby place and got an injection, injection of a hormone done so that they
Mm-hmm.
can prevent they can just facilitate themselves, their family lives, and with the help of a contraception. So here it's very important that first of all, if you want a proper contraception which is effective, here the word effective is very important. So you should actually go and meet your doctor. And
Absolutely.
why am I saying is because in the market there are a whole lot of lots and
Mm-hmm.
lots of things which are available to you.
Mm-hmm.
And the person who is in the shopkeeper, the medical shopkeeper, will not be able to help you to select you want an estrogen progesterone preparation or you just want a progesterone preparation. So here
Absolutely.
I would just simply give you one sentence that progesterones are such hormones of the body which are very much inert, and it is present in our body when once we are pregnant.
Hmm.
And once we breastfeed, some of the hormones are there in the body which helps in the entire mechanism which is going on in our body. And it helps in it will resume of its own as the time is gonna come. So the only hormone which is very, very inert and important is progesterone. And it will not at all affect the supply, the amount of the milk produced, the behavior of the mother, or it will not at all pass from the breast milk to the
To the
baby.
baby. All right.
But in
So,
the contrary, yeah, in the contrary, if there are being oral contraceptive pills which are containing estrogen in a very slightest amount,
mm-hmm.
if it is being consumed for the
Mm-hmm.
contraception, then it will pass through the breast milk and may affect the baby in very different manners.
Okay.
So this is very important,
Mm-hmm.
and all the kind of hormonal methods. For
Mm-hmm.
instance, we talk about the pills.
Mm-hmm.
For instance, nowadays there is a new kind of a copati which is hormonally it's the combination of a hormone progesterone and a copati. There are
Mm-hmm.
lots and lots of implants where you
Mm-hmm.
can just get a patch here, the implant over your deltoid or an implant over your hand,
Okay.
and it keeps secreting the desired and the amount which is needed for the contraception method,
Mm-hmm.
which is the progesterone hormone only. So
Okay.
these are certain kind of things which is completely taking care of progesterone hormone. That
Mm-hmm.
can be taken absolutely without any fear, absolutely without any tension. Like you should be completely like it's okay. It's just a friend to you.
Yeah, yeah, yeah.
Yeah.
Okay, okay. All right. So that was, I think, very insightful, and a lot of breastfeeding moms will benefit from this information, and they will stop going to the pharmacist and taking random drugs. All right.
Definitely.
So yeah, so that's I think the need of the hour. We have all learned a lesson through the pandemic that we cannot consume any drugs without the prescription, and I think. Yeah. So I think we are moving towards the end of the session, and it was really wonderful to talk on this topic. And this topic is very least talked about, and people prefer to keep quiet on this
Yes.
topic. And a lot of questions of a lot of mothers remain unanswered, and since they don't know their choices, so they go for random methods, and a lot
Absolutely.
of women yeah, they get that conceive, and then they get into the trap of all those things, and they then worry, and unnecessary stress has been created. So Dr. Shubhanjali, it was really nice of you, and you shared your knowledge with all the breastfeeding mothers, and this is the world breastfeeding week going on. So we want mothers to understand that everything breastfeeding can be fixed. So no matter if you are on any drugs, you should talk with your care provider, you should talk with your gynac and understand the composition of the drug and whether it is going to be helpful for your breastfeeding or not. So I think everything can be manageable. A
Yes.
lot of mothers, they think in the opposite direction and might want to quit breastfeeding because they have some medical issue and they would like to leave breastfeeding. So before going to that point, I think we should sit back and we should take help from the doctors and understand the importance of I think every mom should be given the support and should be reassured that she can continue breastfeeding, especially in the pandemic. So it is really necessary for the mother and the child both. For the mother, it helps the mother to bond with the baby, to love and care for the baby. It naturally comes in her. And recent studies tell us that moms who breastfeed, they protect themselves from heart ailments and stroke, brain attacks. So it's very important for her as well. It will give her a lot of protection from cervix cancer and maybe breast cancer as well. So I think nothing should come in the way of breastfeeding.
Yes.
And uh, for the baby, it has a number of benefits we already know. So we are blessing the baby by breastfeeding them with a lifelong of immunity and so many other benefits for the baby. Such babies really fall sick very less and they have diseases. So thank you so much, Dr. Shubhanjali, for your time. And
Thank you.
we'd like to wrap up the session. So
Yes.
thank you. Thank you, ma'am.